So, you or someone you care about is considering deep brain stimulation, or DBS, and you're probably feeling a mix of real hope and, let's be honest, some anxiety. It's a procedure that can absolutely change lives. But what about the risks? That's exactly what we're going to break down today. I mean, just imagine it regaining the ability to write your own name, or to hold a cup of coffee without a single spill, or just being able to walk without that constant worry. For so many people with Parkinson's, essential tremor, or dystonia, DBS can make that stuff a reality again. But it's not a magic wand, right? It's a major surgery, and that's a huge decision for anyone to make. So, how do you even begin to weigh those incredible potential benefits against the risks? That's the big question, isn't it? And that's what we're going to tackle in this explainer. We're going to look at the real evidence-based risks so you can walk into your doctor's office feeling way more prepared. Let's dive in. Okay, so the whole journey really starts with the procedure itself. Let's first talk about the risks that can happen during the surgery or in that period right after, what the doctors call the perioperative period. This chart does a great job of putting the main surgical risks into perspective. On one hand, you've got infection. Now, that's a possibility with any surgery, and it's the more common concern here. But the one that really worries people is, of course, a brain bleed. And as you can see, that is incredibly rare, happening in less than 1% of surgeries. And to get even more specific about that bleeding risk, the data shows that the risk of mortality from that surgical hemorrhage is about 0.4%. So the takeaway here is really important. While it is the most serious thing that could happen, it is exceptionally rare. You know, it's also good to be aware of a few other less common things, stuff like seizures or a little bit of air getting trapped in the skull or a minor fluid leak. These things can happen, but the key is that they are almost always temporary and they tend to resolve on their own without anyone having to do anything. So, you've made it through the surgery. Awesome. Now what? Well, the next chapter is all about living with the DBS device day to day, and the challenges here are a whole different ballgame. It's really helpful to think about long-term risks in two totally separate buckets. First, you've got hardware issues. These are physical problems with the actual tech that's inside you. And second, you have stimulation effects. These are side effects caused not by the device itself, but by the electrical current it's sending out. Just think of the DBS system like any other piece of technology, right? Over many years, things can wear out. An electrode could shift a tiny bit, a wire might break from movement, or the battery could just run out. For most people, this is an inconvenience that might mean another minor procedure. But for someone with severe dystonia, a sudden stop in stimulation can be a serious medical issue, causing their muscles to lock up. Okay, now let's talk about those stimulation effects, starting with your movement. Sometimes that electrical current can spread just a little bit to nearby brain areas, and that can cause things like slurred speech, some new involuntary movements, or problems with balance. You might also feel a tingling sensation, especially when the device is first being programmed. And it's not just your body that can be affected. DBS can also have a real impact on your mood and your thinking. You might suddenly feel down or maybe unusually energetic. You might even struggle to find the right word when you're talking. These are very real side effects, and it's so important to be open with your doctor about them. Now, this is probably the most important thing to remember about all those side effects from the stimulation itself. They are not permanent. With a simple adjustment to the device's settings, your doctor can almost always make them go away. This is a huge, huge advantage of DBS. Okay, so this brings us to a really practical challenge that patients and their families face all the time. A new issue pops up. Is it a side effect from the device, or is it just the underlying disease getting worse? How can you tell? So how do you play detective and figure this out? It's actually pretty straightforward. Your doctor can turn the device off for a little while. If the new symptom gets better or goes away completely, well, that's a big clue that it's a side effect. But if the symptom is still there with the device off, it's probably the disease progressing. It's a simple but really powerful diagnostic tool. All right, so after hearing about all these potential risks, you might be wondering, what are the doctors actually doing to prevent them? Let's look at the proactive strategies and safety nets that are built into the whole DBS process from start to finish. So how do doctors stack the deck in your favor? It really comes down to these 4 pillars of safety. First, they are extremely careful about making sure you're a good candidate in the first place. Then, they use incredibly advanced imaging to place the electrode with pinpoint accuracy. Modern devices even have steerable leads so they can direct the current exactly where it needs to go. And finally, it's not a one-and-done thing. They work with you over time to meticulously fine-tune the device for the best possible results.
Finding the right DBS settings is a lot like tuning a musical instrument. It's an art. It takes time and skill to find that perfect sweet spot, that therapeutic window where everything is just in harmony. That's exactly what your doctor is doing during those programming sessions. They're searching for that perfect balance between getting you the most symptom relief with the fewest side effects.
And finally, there are two absolutely crucial, non-negotiable safety rules for anyone living with a DBS device. First, you must avoid a type of deep heat therapy called diathermy, as it can literally fry the electronics and permanently damage the system. Second, you have to be extremely cautious with MRIs. Only certain machines are safe, and your device must always be put into a special MRI mode by a specialist before the scan. No exceptions. Look, the goal here wasn't to scare you. It was to empower you. Because now that you have a much clearer understanding of the risks, you can have a better, more productive conversation with your doctor and your family. So take this knowledge, write down your questions, and go into that next appointment with confidence. You've got this.